So I'm going to talk to you about some common things in head and neck imaging. But here we go. If you just want to have that kind of like the view from 30,000 feet, what imaging test do you choose? This is kind of the way I look at it. I am unashamedly a CT fan. CT is very often diagnostic for a lot of head and neck pathology. It directs therapy immediately. Patients are going to go to the OR. Very often that's the information they need. That's enough to get you there. So I like CT, but certainly I do a lot of MR, read a lot of MR, and I think MR has incredible utility. In problem cases where there are very specific and directed questions, classically orbital or intracranial disease as an extension of head and neck tumors and head and neck infectious disease, MR clearly has a leg up. Ultrasound, we don't do near as much ultrasound as the Europeans do, but I think ultrasound is vastly underutilized. And the evaluation of local disease, patients, the first topic we're going to talk about, just a neck mass, we don't do enough, and it's a very good study. Interestingly enough, I've had this discussion with a lot of people over the years. My training program, our residency program, is now buying our new residents a handheld ultrasound device. And it's theirs. And they use it. They walk around, when they go, we have a resident that's always assigned to rounds with a clinical team, and they cart their little ultrasound device around with them. And I'm sure they ultrasound their friends and, their pets or whatever at home too. But the widespread applicability of ultrasound and the widespread use of ultrasound is something we all have to acknowledge now. Everybody's got one. All my ENT surgeons carry one in their pocket. They're everywhere. We don't do enough ultrasound. We've kind of allowed that to kind of slip away from us, and I think that's unfortunate. So here's some common presentations that we're going to discuss. A neck mass in an adult, puffy, bulging, or red eye, red throat, red neck, ear pain. So let's begin with a neck mass. Neck mass in adult patients. So a patient in their 40s, 50s, typically the setting is like someone's either putting on their makeup or shaving in the morning, and they notice they have a little bump on their neck, and they feel it, and there's something there. Occasionally, they are first discovered by their family physician. So a neck mass in an adult patient, how should it be addressed? I think, we all went to medical school or the radiology tech. There are a few techs in the audience, I understand. We all kind of understand how we should deal with something. We want to question it and get our fingers on it and kind of what is it? So the history and physical examination is very important. And particularly with head and neck disease, a careful attention to people who have smoked and drank a lot. That's very important. ENT surgeons are invariably going to scope people. They have those flexible scopes. They're very easy to utilize. So a direct visualization of every visible mucosal surface is pretty much a part of their examination. But then we have the next part of the list, and that's ultrasound plus or minus needle aspiration, antibiotics, follow-up, and imaging. And the order of those items and how you apply them is really the whole key. And if there's a little artistry here, that's where the artistry is applied.